My next guest is a frequent guest on the Larry Elder Show. He's also a reserve deputy and tactical doc for the local law enforcement SWAT team. Pretty interesting. He served as associate clinical professor at UC Irvine and a board member of the Orange County Medical Association. He completed his medical school and family practice residency at University of California, Irvine. Board certified primary care doc for over 25 years. Please welcome back to the program Dr. Jeffrey Barke, whose website is personalcarephysicians, that's plural.com, personalcarephysicians.com. Please welcome back to the program Dr. Jeffrey Barke.
Sage, great to be with you.
Doc, how are you?
I'm doing great. How you doing?
Not bad, Doctor. I want to ask you about this. 2 weeks ago, I visited Mrs. Jeffries, my mom's best friend. My mother is no longer with us, but Mrs. Jeffries still is. She's 96 years old, Doc, and refuses to get her shot because she said she got a flu shot a few years ago, had a bad adverse reaction to it, and therefore is very skeptical about getting any shots going forward. I've had both my shots, the last one about 3 weeks before I visited her, Doc, and I wore a mask. Her caregiver wore a mask. She did not wear a mask. Analyze that situation, Doctor.
I love her tenacity, first of all.
Okay.
And I think it's perfectly reasonable for people to make such a choice. What I would recommend to her if she's choosing not to get a vaccination is to consider going on prophylactic medication, and that could be either ivermectin or hydroxychloroquine. In addition, she should be on some supplements. And so the vaccine is available. I think if you're in a high-risk group, it's perfectly reasonable to consider getting that vaccine, but only after informed consent and you understand what the risks and the benefits are, and it should be eventually available to anybody that wants it.
Okay. Second incident just happened a few hours ago, Doc. I probably should have handled this a little bit differently. I'm not saying I'm proud of this, but I go to my dentist this morning, and it's an underground garage, but the outside of it is really open to the street. You're only about 8 or 10 feet away from the street when you are leaving, and everything is wide open. They require you to wear a mask when you go underground in the garage. I wore the mask. I come out. I don't have the mask. I have the mask on. I get into my car. I put the mask in my back pocket. I get into the car and drive up to the window to pay. And the lady kind of barks at me and says, "You need to have a mask on." And I said, "I'm in my car." And I had my arm out to her, 2 inches away from her to get the $6. I had it in exact change. And I didn't put the mask on, and she reached for the money, and then I said, this is probably what started the whole thing, Doc. I said, "Well, I see. I guess we're close enough for you to get my money." And then she pulled the hand back. It ticked her off. She pulled the hand back, and then she picked up an intercom and called somebody. Now I had an appointment, and I had to go, and there wasn't any rail down in front. And $6. I come back there in 3 months, and I said, "Do you want the money or not?" She's on the intercom, and I just left.
Yeah. Well, I'll tell you, Sage, you remind me of my dad, Mort, who's listening to us while smoking a cigar in Dallas, Texas right now. And unfortunately, this whole mask thing has reached a level of ridiculousness. Whether you think masks work or they don't work, this idea of masks shaming people and getting quite angry at people because they choose to make a different decision than you think they should be making is just silly.
The CDC has just issued new guidelines saying they are encouraging in-school learning provided the kids are 3 feet apart as opposed to 6 feet apart. What's going on with all these mitigation recommendations that the CDC is making in order to encourage people to go back to school, in-school learning?
It's opinion masquerading as science. There's no science behind any of this data. There is no science behind the 6 feet mark, and now 3 feet. Suddenly, Dr. Fauci tells us that that's safe. 1 mask, 2 masks, 3 masks, you count them up. So unfortunately, we're no longer having a scientific debate. We're not having an exchange of ideas in the scientific community. You either follow the prevailing wisdom or your voice is silenced and banned. And that's really too bad, because we should be able to get through this with reasonable people disagreeing, having a discussion, and coming to common ground. But as it relates to our kids are unfortunately being harmed as a result of some of these policies. We've never asked ask the question, what is the result of the policy of keeping kids out of school? What harm could possibly come to kids? Well, we're seeing the highest teen suicide rate that we've ever seen in our country's history. We're seeing lost years of education. We're seeing spousal abuse and domestic abuse and child abuse and substance abuse. So we are harming our children almost beyond recognition. And now as we open up schools, we're putting in place rules that make no sense at all. Masking a child is a form of child abuse. Kids are not at risk of COVID-19. There's little evidence that they spread the disease to at-risk teachers. And this social distancing among kids is not necessary. And for God's sakes, why are we making kids wear masks while they're participating in athletics? That makes no sense at all. Yet parents are tolerating this for some reason, and in part because they are taught to be fearful, and it's too bad.
My guest is Dr. Jeffrey Barke. He's a board-certified primary care physician. His website is personalcarephysicians.com. Dr. Barke, suppose Donald Trump early on had gotten concerned about the coronavirus vaccine, picks up the phone, calls Dr. Jeffrey Barke and says, I want you to be in charge of this whole thing. How would you have handled this thing?
Well, thanks, Sage, for the confidence. I think he did a pretty good job. Rather than just allowing the government bureaucrats to roll into action, and 5 years later we had a vaccine, he put the private sector into play, and that's why Operation Warp Speed has been so successful. So I think we've done a good job at rolling it out so far. Unfortunately, individual states are making mistakes how they roll out the vaccine. It's quite bureaucratic. These large gatherings in Southern California at Dodger Stadium and at Disneyland and so forth, I think we need to get the vaccines into the hands of physicians and physician offices so we can give them out to our patients as well, not just through giant bureaucratic systems. But patients also need to be educated about the vaccine. This is an investigational vaccine using brand new technology, messenger RNA technology, never used before in a vaccine, with limited safety data. So the safety study should be presented to individual patients. They should make a decision like your 96-year-old mom's friend. Mm-hmm. She's making her decision, and that should be honored, but at the same time, she should be told how to protect herself and others as well.
Dr. Barke, don't go away. My guest is Dr. Jeffrey Barke, Family Medicine, Newport Beach, California. Personalcarephysicians.com is the website. I want to ask you when we come back, Dr. Barke, about spring break. A lot of people in Florida are concerned there's going to be a spike. And what about the variants? Should we be worried about these variants? Dr. Jeffrey Barke is my guest. I'm Larry Elder.